Good evening, everybody. I am Dr. Arnab from Resident, Kolkata National Medical College. I would like to say some information or share some information with you about dementia. Now, dementia is the forgetting disease of the elderly. I think you must have encountered your elderly relatives who are forgetting things. Probably they are suffering from dementia. How to know that this is dementia? So there are some diagnostic criteria. The first one is declining cognitive functions. That means the memory. Memory is one cognitive function that will decline. They will be finding it difficult to remember things. They will be taking help of calendars, calculators, notes to remember things. So whenever you see such symptoms, it can be of dementia. Not only that, not only cognitive decline, this decline should be over time. It must be chronic. So these symptoms will not appear overnight. Gradually, they will creep in. So you have to be looking for. You have to be cautious to look for these symptoms. And lastly, the patient will be finding it very much difficult to perform their day-to-day works with this dementia problem. So this is basically dementia. And as I have explained the symptoms, I know you have already remembered some of your relatives who are presently having all these difficulties. So what happens to the patient basically? The patient realizes gradually that the basic things he or she used to perform, they are not being able to perform them. So they tries first to hide symptoms. They become depressed. So it is difficult for the caregiver also to diagnose the symptoms or to notice the symptoms at first. So dementia is not a stat diagnosis. Over the time it develops, and for the relatives also, they notice that difficulties quite late in the disease. So, as a caregiver, there are difficult types of medicines available. What should you do? First of all, you should be quick to recognize the problem and consult your doctor so that the medical therapy can be started early. The earlier you start the medical therapy, the better is the prognosis. From the caregiver's point of view, it can be difficult because these patients keeps on deteriorating gradually. In spite of all your efforts, they start deteriorating. So you suffer from guilt that I'm putting so much effort, but it's not improving. Okay, sometimes you get frustrated, you get angry on them, but you can't ventilate your feelings because the guilt creeps in. So, from a caregiver's point of view, you can also suffer from different kinds of psychological symptoms. So, be aware of that also and consult your doctor. Thank you.